The third month of pregnancy is a milestone for every mother. It marks the end of the first trimester, a period filled with transformation, protection, and preparation. During this month, your baby grows rapidly, organs form, and your body starts to adapt for the months ahead. Many early pregnancy symptoms begin to stabilize, while new changes start to appear. Let's explore in detail what happens inside a mother's body and how the baby develops week by week during the 9th to 12th weeks of pregnancy. Blossom, what happens inside the mother's body. During the third month, your body is busy working behind the scenes to support your growing baby. The placenta, your baby's life support system, is almost fully formed. It connects to the uterine wall and supplies oxygen and nutrients while removing waste products. Your blood volume increases by almost 30–40%, and your heart begins to work harder to pump this extra blood. Your uterus expands to accommodate your baby, now about the size of a lime by the end of this month. Though your belly may not be visibly large yet, you might notice your waistline thickening slightly and your clothes fitting more snugly. You may also notice frequent urination due to the growing uterus pressing on your bladder. Mild cramps or stretching sensations in the lower abdomen as ligaments expand. Breast tenderness and fullness as milk glands continue to develop. Fatigue from hormonal changes and increased blood production. Morning sickness, though it may start to fade by the end of this month. The internal systems, reproductive, digestive, cardiovascular, and hormonal, all adjust to nurture your pregnancy. Estrogen and progesterone levels rise, helping sustain the uterine lining and prepare the body for further growth. Baby's development week by week. Let's see how your little one grows through each week of the third month. Week 9, the embryo becomes a fetus. At the start of the third month, your baby officially becomes a fetus. The tail-like structure at the end of the spinal cord disappears. The head is large, but slowly starting to straighten from the chest. Eyes are fully formed but still closed, covered by thin eyelids. Tiny ears start to develop on the sides of the head. The heart is beating strongly, at around 170 beats per minute. Little buds that will become fingers and toes are clearly visible. Your baby measures around 2.3 cm, about 1 inch, and weighs about 2 grams. Week 10, organs begin functioning. This week marks the beginning of organ function. The brain is rapidly developing. Neurons connect and form basic brain waves. The liver starts making red blood cells. The kidneys begin to produce urine, which is released into the amniotic fluid. Tiny fingernails and toenails begin forming. Baby can make small movements, though you won't feel them yet. By the end of week 10, the baby measures about 3–4 cm, 1.5 inches long, and weighs 4–5 grams. Week 11, facial features become clear. Your baby now looks more human than ever before. The head is about half the total body length, but will soon even out. Facial features, nose, lips, and eyelids become more distinct. The baby's bones are beginning to harden. External genitalia start to form, but it's too early to determine the sex. Baby's movements become smoother. They can stretch, yawn, and even hiccup. Your little one is now about 5 cm, 2 inches, long and weighs about 8 grams. Week 12, the first trimester ends. A major milestone. Your baby's growth accelerates rapidly. The digestive system starts practicing contractions, called peristalsis. Reflexes are active. If you poke your abdomen, the baby might respond. Vocal cords start forming. Fingernails, toenails, and tiny hair follicles develop. The baby's brain is divided into 2 hemispheres. By the end of the third month, the fetus is about 6–7 cm, 2.5 inches long, and weighs around 14 grams. Most of the critical organ formation is complete, making the baby less vulnerable to birth defects caused by external factors. Cherry blossom hormonal and physical changes in the mother. The third month brings noticeable hormonal and physical adjustments as your body adapts to pregnancy. Hormonal changes. Estrogen and progesterone rise. These hormones keep the uterine lining thick and support the placenta. They also cause breast tenderness, mood swings, and nausea. HCG, human chorionic gonadotropin, peaks. This hormone sustains early pregnancy, but is also responsible for morning sickness. Relaxin hormone increases. It softens the pelvic ligaments and joints, preparing for childbirth later. Increased thyroid activity boosts metabolism to meet your baby's growing energy needs. Physical changes. Mild bloating, due to slower digestion and hormonal effects. Fatigue, as your body works overtime to support the baby. Increased appetite. As morning sickness fades, hunger often increases. Breast enlargement. Milk glands continue to develop. Visible veins, especially on breasts and abdomen due to increased blood flow. Skin glow or acne. Hormones may make your skin radiant or oily. Green salad nutrition and healthcare tips. Proper nutrition is the foundation of a healthy pregnancy. During the 3rd month, your baby's organs are forming. What you eat directly supports this growth. 1. Balanced diet. Eat a variety of nutrient-rich foods. Protein, lean meat, eggs, lentils, beans, supports tissue and organ growth. Iron, spinach, dates, and red meat, prevents anemia. Calcium, milk, yogurt, cheese, strengthens bones and teeth. Folate/folic acid, green leafy vegetables, citrus fruits, prevents neural tube defects. Vitamin D, sunlight-fortified milk, helps calcium absorption. Omega-3 fatty acids, fish, walnuts, flax seeds, supports brain development. 2. Stay hydrated. Drink 8-10 glasses of water daily. Dehydration can lead to fatigue and constipation. 3. Avoid harmful substances. No alcohol, tobacco, or recreational drugs. Limit caffeine to less than 200 mg per day, about 1 small cup of coffee. Avoid undercooked meat, unpasteurized dairy, and high-mercury fish. 4. Supplements. Doctors often recommend prenatal vitamins with folic acid and iron. Vitamin B6 for nausea relief. Calcium and vitamin D if your diet is low in dairy. 5. Exercise safely. Gentle activities like walking, prenatal yoga, or swimming help improve blood circulation, reduce back pain, and boost mood. Avoid strenuous workouts or lifting heavy weights. Sparkling heart, emotional changes, and mental health. Pregnancy isn't just physical, it's emotional too. The 3rd month often brings emotional fluctuations as hormones stabilize and the reality of pregnancy sinks in. Common emotional experiences. Relief. Morning sickness may lessen, helping you feel better. Anxiety. Thoughts about motherhood, body changes, or baby health are normal. Mood swings, due to hormonal fluctuations and fatigue. Attachment. You may begin to feel emotionally connected to your baby. Tips for emotional well-being. Rest often. Fatigue can intensify stress and anxiety. Share feelings. Talk to your partner or loved ones about your emotions. Avoid overthinking. Trust your body's natural ability to nurture life. Relaxation techniques. Try deep breathing, meditation, or calm music. Seek support. Join a prenatal group or talk to a counselor if you feel overwhelmed. Remember, mental health is just as important as physical health during pregnancy. Hospital doctor visits and precautions. Your 3rd month prenatal visit is crucial. The doctor monitors both your and your baby's progress. Prenatal checkup includes blood pressure and weight check, blood tests to detect anemia, blood type, and possible infections, urine test for sugar and protein levels, ultrasound around 12 weeks to confirm due date, heartbeat, and normal development, genetic screening, optional, for chromosomal abnormalities like Down syndrome. Precautions. Avoid self-medication. Always consult your doctor before taking any medicine. Prevent infections. Wash hands often, avoid raw foods, and stay away from sick people. Get enough sleep, at least 8 hours per night. Wear comfortable clothing. Loose-fitting clothes improve circulation. Avoid long travel, especially if it causes fatigue or motion sickness. Rose conclusion, the end of the first trimester. By the end of the 3rd month, the most critical phase of your baby's development is complete. Your little one now has all major organs and is starting to look like a tiny human being. For most mothers, morning sickness fades, energy begins to return, and the pregnancy becomes more visible and joyful. The journey ahead will focus on growth, nourishment, and connection. Continue to eat well, stay active, rest, and maintain regular doctor checkups. The foundation you build now supports a healthy pregnancy and a thriving baby. Blossom summary. Aspect key highlights. Baby development organs form, limbs develop, heartbeat strong. Mother's body uterus expands, hormones stabilize. Nutrition protein, iron, calcium, and folate essential. Emotional changes mood swings, anxiety growing attachment. Medical care ultrasound, blood tests, prenatal vitamins. End result transition from 1st to 2nd trimester.